Hello and welcome to Rajya Sabha Television. You're watching our special show, India Fights Back, and I'm Vishal, Dahiya. Today, we're going to talk about how 16th of January is going to be a very important day, a significant day, because that is the day when the vaccine rollout for COVID-19 will begin in several corners of the country. The vaccine has already reached at these designated places where the health workers and frontline workers will receive the vaccine from 16th of January onwards. All preparations have been done. Today, we're going to talk about not only these preparations and the guidelines and the process through which the vaccine will be administered, but also the challenges as far as this humongous exercise is concerned and what more needs to be done. And for more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Samiran Panda, who joins us. He's a scientist chief and head of the ECD division in ICMR. We also have with us Dr. Chaudhry, senior professor and head of the Pulmonary and Critical Care Medicine at Pandit B.D. Sharma, PGIMS, Rohtak. We also are joined by Dr. NK Ganguly, former Director General, Indian Council of Medical Research. Welcome, all of you gentlemen, to Rajya Sabha Television. And indeed, a landmark day, 16th of January. A lot of hard work which has gone in terms of preparing for this particular day, be it development of vaccine or even putting the infrastructure in place. So let's start, and let me start with Dr. Panda here. Dr. Panda, where do we stand in terms of our preparations? One, two, the way this entire infrastructure has to react to various dynamic situations from 16th of January onwards.
Well, we stand at a very critical juncture, I would say, and it's a historic moment. India, as a big country, and there are very few countries, probably none, except for China, having such a big, not only geographical diversity, setting, but also population. And the preparation that have been going on, that had been going on for the last 5 months, and now we are there where the vaccine needs to be administered. Of course, this is not to be done for the general population. Now there is clearly prioritized groups, and the 2 vaccines have received emergency use authorization, and the specific phrase of the clause under which this is being used is restricted use in emergency situation. So the preparations are all on. And of course, I would expect, a few lapses here and there because it's a huge management challenge. But most of it has been done so well. And over the last 5 months, I really, I'm excited and I'm waiting for that moment when it's going to be given. And all the state health machinery and the state health authorities, they have been working 24/7 over the last 5 months or so to make this happen. So I really do not, expect to see any major setback because the preparations have been very thorough. And secondly, the CoWIN system, the COVID Vaccine Intelligence Network that will capture the data in terms of the particulars of the vaccine recipients and also the follow-up data in terms of the adverse events, if there is any. But we have to be always remain very careful about what is happening in the community so that ears and eyes in the community have also been ensured so that any minor side effects like following an injection, if there is a little bit of pain or fever, which is expected, that should not create any major panic. So those are also being handled. So it's not just the state health authority, it's not just the availability of the vaccine and the forms that need to be filled in. One form is fact sheet, which talks about the details of the vaccine. The second one is about the informed consent, which will be administered for Covaxin. And the third is about the adverse event reporting form. All those forms have reached to their respective booths and the states. And then this whole CoWIN software and the system, which will capture this whole process, they're all in place. And all of these will happen along with the health authority as well as the community-based organizations.
Okay, indeed. So the preparations are pretty much in place there. Let me bring in Dr. Dhruva Chaudhary here as well from PGIMS Rohtak. Dr. Chaudhary, you've been, on the front lines as somebody who's been battling this particular pandemic since day one. And what we need to understand and know right now, what our viewers need to know is how are these preparations, which Dr. Panda was referring to, are actually translating on the ground, in the interiors, in places like where you are right now, wherein the entire action will be, apart from obviously the metro cities or the capital cities?
Thank you, Vishal. I think Dr. Panda has given an explicit view about it, and I myself now being a part of the State Technical Task Force and Advisory Wing. So today we also had a meeting at 3 o'clock today, and it has been working out. And I want to share it with you practically at each district headquarters. Already the vaccines have reached, and already they have done it. Dry runs have been done, including in medical schools, and things have been prioritized. So in terms of our preparation, I think we are all in place. And I do not see a major glitches, and because of the excellent infrastructure network which we have because of UPI, which is Universal Program of Immunization. So the district immunization officers have been there, and I think the master stroke, which I must compliment the team, has been combining it with our ability to deliver the election machinery. So actually these two things have combined together, and that's what I look at it, that it should be able to work it out. That is number one. Secondly, I think what is important is that people are looking forward to, and already they have been briefed, they have been told, and already twice the dry runs have been done. So I do not expect too much of it. There may be few local glitches may happen here or there. I think that can be easily fixed. And as I said, the most important part, which is important, is for me, the bigger challenge is not the delivering the vaccine, because this is what we are used to. Let me be put into it. Like if you look at the pulse polio programs and all. So we are used to it. But for me, the bigger challenge will be, as a clinician, is to convince my colleagues to come, though, because it's a voluntary act. It is not a mandatory thing to come and have a vaccine. And once we are able to do that first phase, obviously we'll be to convince the general public in large, especially in the tier 2, tier 3 cities and the villages, to come and have the vaccine.
Okay, definitely. That is one of the very important tasks there, and we'll talk about that also. Let me bring in Dr. NK Ganguly as well. Dr. Ganguly, your views on this entire episode of preparations, dry runs, and this historic day, because having a vaccine within almost a year of a pandemic striking us is something which is in itself an achievement.
Yeah, it's a great achievement. And up to now, it has run like a dream. Like supply chains worked like a clockwork. The cold chain is in excess, actually. We are good with the cold chain. An app has been put in place. Vaccinators have been trained, as well as the state governments have been sensitized. So up to now, it has run up to clockwork, and but there are huge challenges, and we will have to see how we handle the challenges. Up to now, 27 million are the children who are vaccinated, and 30 million are the mothers or the ladies who are vaccinated. So we have vaccinated up to 57 million persons. At this given moment, our population is 1.3 billion. And if we take out some of the children and others from the ambit, we will have to immunize about 600 million people, or at least 500 million. So if we give 2 doses, we will have to deliver 1 billion doses. And this will be a huge challenge to keep the supply of these vaccines so that we could deliver to the public. Because if we don't do this, the transmission will not stop. To build the herd immunity, you need to get at least 60% to 70% of the population. So we will have to solve that. How do we deliver this, and when this actually challenge comes? So I have few suggestions. At the moment, according to priority, we are actually trying to protect the most vulnerables.
Okay.
That those who are frontline workers, health workers, healthcare workers. However, to make it easy, what Mr. Nandan Nilekani told me yesterday, that it will be good to link with the Aadhaar card, because this CoWIN app at the moment have some glitches, and people like me who are not very computer savvy or app savvy, they, when like older generation, will have a problem, and those who do not have education, they will have a problem with this. So what he felt that Aadhaar card is with everyone, and people are used to it. So could we use Aadhaar card into this? So this is one of my suggestions. My second suggestion is this, that many people are now not taking the history that you have a comorbidity or not. If you are 75 and above or 65 and above, you are getting vaccinated, because your chances of comorbidities are very high, and you don't have to take a government certificate to really add on to this from a physician certificate. It actually delays the thing, and it creates issues and problems. So I will vaccinate anyone who is above 65. I will put them on the priority, and these are the vulnerable. They die most. Whether they have a comorbidity, they don't have comorbidity. So I will try to protect them by providing them this particular arena.
Okay.
After that, I will also launch a major communication and advocacy strategy to remove any misconception about vaccine, so that the general public gets some confidence, and they voluntarily come to take the vaccine, because at this given moment, this is in an institutionalized structure. It is working like a dream. But to bring people to get the vaccine in arm, ultimately this size of population in the communities and in the rural areas, it will be a challenge, and we should work on that.
Okay.
We should have massive communication advocacy strategy and be very transparent, so that the confidence of people is gradually built up to a stage where they will voluntarily come. One more thing, I have a suggestion, that at this given moment, I'm studying the global experiences, and we should learn from global experiences, and we should do this here. So in many countries, to get it much more easily, some countries are using football stadium, some countries are using drive-in. The issue in those is this, that you will have to make the person wait for 30 minutes, because if there is an allergy, so that the person is taken care of. Drive-in, etc., are a little risky, but large arena where communities could come in large number and get vaccinated could be one of the options which we should look in the future.
Okay.
Finally, I have one more suggestion. This suggestion is this, that very soon there will be one vaccine which is coming up. That is a dream vaccine. That is the Johnson & Johnson's vaccine. Its reports are very good. It is a one injection vaccine, and BioE in India is making it. So by the end of the January, they are giving it to US FDA. So we need to be prepared when we have more than few vaccines in the market. What we will do? Pfizer's vaccine already has been given to Indian regulator. Could we then put it in the private market, so that large number of people who could voluntarily take it, they voluntarily take it, because our goal should be the maximum of the population need to be immunized. So those who will get from government, they should get from government, and those who want to take it. So this will happen in few months. So people the first round and those in the priorities perhaps will be covered by that time. So when it comes to general population, at that time, that strategy will be very good. So these are my suggestions.
Okay, definitely. These are very, very important suggestions there. And let me also bring in both Dr. Panda and Dr. Chaudhry here. Dr. Panda, first, I'll come to you in terms of, the challenges there when we talk about this vaccination drive and these suggestions which have come in from Dr. Ganguly, how they can be implemented in future stages of this vaccination drive.
Of course, the most important of the suggestions that were highlighted by Dr. Ganguly, I would pick up the engagement of the community, because that would really help in not only having or ensuring community participation, but also dispelling the myths and misconceptions, because it's quite expected that some of the rumors would start floating around, and we should not wait for those rumors to die of their own. It is very important, because this is the age of social media, and everybody tries to learn from WhatsApp messages or social media based messages, many of which are at times wrong. So I would say that engagement of the community, address misconceptions and myths which are floating around would be so very important, because very recently we got to know about this wrong information that this vaccine might lead to infertility, which is absolutely nonsense. So we have to give the right message to the community. We need to have our amplifiers of the right messages in the community. That's the most important. And again, challenges can only be dealt with very appropriately when the government, health system machinery, and the community who are the vaccine recipients, they work hand in hand and with mutual trust and respect for each other.
Okay, indeed. Those are two very important, significant points there. Dr. Chaudhry, your views on the challenges there. You referred to a few of them in your initial response, but these suggestions which are coming from Dr. Ganguly, they're really, really relevant, starting from day one till the entire vaccination drive is completed.
I think Dr. Ganguly is a very experienced hand in it, so is Dr. Panda. Being a clinician and looking at the front line when we deal with it, I think confidence building is the key. That is the one which is important. And in fact, for me, the most important part is the confidence building in the medical fraternity to begin with. Because the number of questions which are being put, I know the infertility thing which has been started has been going on with vaccination for a long period of time. But one needs to tell it very clearly. When somebody from a medical fraternity yesterday asked me, I was just taken aback. I think that's important. So communication strategy of the government, of the people who are involved in it and planning and all, has to be excellent. Because one of the classical examples of that failure to communication has been, if I may put so, is when the Covaxin was declared. In fact, one should have welcomed the idea, questions and answered it. Those misconceptions would have immediately disappeared. Two. Third, I think we should also need to tell very clearly is that Indian science has risen to a place where they're second to none. It's not that I'm taking from the patriotic and nationalistic figure, but it is because we know what we are doing. You look at the total clinical mortality of COVID in India is far less than any Western country, irrespective of the same severity of the disease. So there must be something extra we are doing. Then fourth is that you also realize it that on communication, especially the top journals, there's a lot of biases there. I have no hesitation in saying it. And I'm saying it because the data which has been presented from our country has been lying unpublished after acceptance for more than 6 weeks. I know Dr. Panda knows about it, what I'm saying probably. So I think these are the things important. One. Second, as Dr. Ganguly said, we need to, it's not that one is a national level policy, another will be state. So we may sometimes has to customize as per the need and the place quickly so that the communities, they accept it. And again, I'm saying the biggest challenge will be, let's say I give an example, is in Delhi. We did a sero survey, we find 25% people probably are having a this community already had a coronavirus infection. Now we are doing a fourth phase. In Haryana, we did it also. And when we did a first phase to third phase of Covaxin trial, from 3% it jumped to 15%. I think we need, and we are collecting that data. And in the process, what we are doing, we probably need to amend, change I will say it should have an adaptive model. As the data keeps on coming up, we keep on adapting it. Suppose, as a medical professional, like I had a corona, you had a corona. We have good antibodies. If one single does a boost it, probably we may not need a second one. We still don't have an answer to this. So probably it is these trials which are going. I'm giving just an example. So adaptive model, we need to adapt it, see it, and as they have said it, in a trial mode, I think we need to have a very clear monitoring of these things, including if need to be having a little more phase trials or clinical comparing and then seeing is what is happening. I would like to go that way in a scientific fashion so that I have a robust data with me. And by end of 6 months to 1 year, I know where I stand at the same time, able to stop the communication of the transfer of the disease or the spread of the disease.
Okay,
that's how I.
Definitely. Data does play a very, very important role here. And as you're pointing out, Dr. Chaudhry, we need to look at it in a completely scientific manner there, specifically for the long run. And let me also have the quick concluding comments from Dr. Ganguly. Dr. Ganguly, look at the long-term aspects as well as you're referring to in terms of, what needs to be done when it's a turn of the general population, and specifically when there will be other vaccine candidates as well. And as Dr. Chaudhry is pointing out, there might be other adaptive models as well. And it's sort of a dynamic situation. We will have to keep on changing our strategy.
So one of the things which Dr. Chaudhary stated is very important, that we should go on collecting phase 4 data, post-marketing data, which will be very rich and give us a lot of pointers to really correct and implement. And we should have a central data repository as it is in certain countries like Chris Murray or John Hopkins. And this data need to be analyzed and to be fed to the implementers and policymakers and the government, so that if there is any course correction, they could do it. We should also strengthen the surveillance, molecular surveillance. Now, apart from the UK and the South American strain, much more dangerous strain from Brazil has reached different shores. And if we do not have a surveillance, we will not know whether our vaccines are working on these strains or they are not working on these strains. Finally, the one particular population has been left out in our country. They have been prioritized in other countries. These are people who are institutionalized, like old age homes, nursing homes, which are in the care. These guys die like fly. And these guys cannot come to hospitals to get immunized. So they have to be immunized at where they are. Okay. So this is something which we need to prioritize. Finally, one of the things which we need to concentrate now is opening up our school, colleges and universities. It is most essential. If we don't do this, there will be an issue. So I will prioritize to immunize the school teachers and other adult school guys, school and university guys who are able to open up the schools. At least they are protected. And if they put in other public health measures, we will be able to open up school and universities. Okay. So we should have a robust plan of opening up schools and universities. And if it opens, we will be solving a huge, big problem in our country. Okay. So we, as we have been discussing, we need to go on innovating and doing course correction so that we protect the most vulnerable, and we also build up our economy. If the economy goes down, we will not be able to vaccinate. We will not be able to really implement it nationwide very effectively. Finally, one more comment. We need to bring in religious people. Like in this, we had the same thing in the polio vaccine, that it will reduce fertility. Some people say the porcine elements are being used. Some people say bovine elements are being used. These can be handled by religious communities very effectively, which has happened in the past. So we should engage them into this so that they remove the misconceptions in their own communities who have such problems.
Okay, indeed. So these are some key points, not only about preparations, but challenges as well when we talk about the COVID-19 vaccination drive. And as our panelists pointed out, everybody, all stakeholders need to put their best foot forward out here and work as a team to ensure its success. Thank you so much, Dr. NK Ganguly and Dr. Dhruva Chaudhry, as well as Dr. Samiran Panda, for sharing your time and views with us. Before we take your leave, let us also remind you once again about the COVID-appropriate behavior while the vaccine is around the corner and it will start on 16th of January. Do not forget these 3 simple steps: wearing a mask, washing your hands, and maintaining physical distance of at least 6 feet. These are 3 simple steps which will ensure your and your near and dear ones' safety. Thank you so much for watching Rajya Sabha Television.